in Radio Land, and a pleasant welcome to yet another very informative and educative edition of the program Inside JFK. Inside JFK is a 45-minute radio program brought to you by the management of the John Fitzgerald Kennedy Medical Center. A program that provides you, our listeners, the opportunity to interact with policymakers and medical doctors on the John Fitzgerald Kennedy Medical Center, where you discuss health-related issues and other administrative issues at the JFK Medical Center. You will get advice on health-related matters from our specialists, our doctors at the nation's premier medical center. So today is Monday, August 7th, 2023, and today we have the Department of Surgery, and we are going to be discussing the topic of minimum invasive surgery. What are some of those surgical operations that have been conducted at the JFK Medical Center? Dr. Uh, Frizzle Mambanza, who is a consultant surgeon at the JFK Medical Center surgical department, he's going to be telling us more. And recently, there was um, surgery, I said last week, surgery that was conducted at the JFK Medical Center, and it is the first of its kind. Like it is an invasive, minimal invasive thoracic surgery. Thoracic, I think, had to do something with the chest, and but Dr. Mambaza will explain or elaborate more on that. But I'm your presenter. James Bill Curtin is my name, from the communications department at the JFK Medical Center. So we now quickly go over to Dr. Mabasa, who will introduce himself and tell us what his position is at the JFK Medical Center. Good afternoon, Dr. Mambasa, and welcome to the program Inside JFK.
Good afternoon, Clayton.
This should be your debut presentation on the program.
Sure.
We welcome you.
Thank you.
Yeah. So, can you please tell us what's your position at the JFK Medical Center? Who are you?
I'm glad to be here. Trezo Mabanza is my name. I'm a consultant surgeon at JFK.
Okay.
Yeah. So we're here basically to talk about the minimally invasive surgery as a whole and more about what we did last week at JFK.
Okay. So we will do it bit by bit, and
Sure.
we want to be very structured like we usually do on the program. So we will start up with because most people in our setting may not understand when we say some of those medical jargons and all of that. So when we say minimally invasive surgery, or how can you break that down to the understanding of the layman who is listening to the radio and wanting to hear, oh, Dr. Mabasa is on the radio or Dr. from GFK is on the radio to explain to us? How can you break that down to their understanding? What is a minimally invasive surgery?
The simplest way that I can put it down is minimally invasive surgery has to do with the classic or the traditional way of doing surgery. Okay. What people know about surgery, we will make a big opening on the body in order to access wherever we want to go and then remove something or fix something inside the body. That's the traditional or classic surgery. But minimally invasive surgery, the difference with the first one that I said is instead of making a big opening, which we call in medicine incision, we don't make a big opening, a big wound on the skin. We make a very small wound on the skin with the use of images, be it ultrasound, be it CT scan, or be it camera like endoscopy. We go to the part of the body that we want to work on, and then we use more the image instead of seeing with our naked eyes.
So if I understood the definition very well, I think you were talking about how technology has is supporting or contributing to the health in terms of those interventions that you make or procedures that you carry on.
Sure.
So it's all technology.
It's really all about technology. You can't talk about minimally invasive surgery without technology.
Okay. So that's the definition for minimally invasive surgery.
Yes.
So let's come to the procedure. I think you started by saying some of the things that are involved, like the equipment you're going to use and all of that.
Sure.
But let's know the procedures for conducting a minimally invasive surgery. What are the procedures?
Yeah, to conduct a minimally invasive surgery, it depends on what kind of. That's why I need to really break it down.
Yeah, sure.
Minimally invasive surgery has to do with every surgery that we conduct without making a big wound. Though the possibility of making a big wound is there, but we don't make a big wound, but we get to the organ or to the part of the body that we want to work on.
Okay.
Let me give an example.
Yeah.
Something that people are familiar with is like the appendicitis.
Yeah, appendicitis.
Usually with appendicitis, you go to the hospital, the doctor will make a wound on the right lower side of the stomach, and then they will remove the appendix. You will see it.
Okay.
But with minimally invasive surgery, we will put a small wound on the skin, we pass a camera in the body, and the camera shows the appendix, and then we remove it through another small hole. That's for appendectomy.
Yeah.
For the appendectomy, minimally invasive surgery entails to have a camera. It entails to have a image source, a light source, and a monitor.
Wow.
Something that looks like a TV.
Yeah.
3 main things.
Yeah.
Image source, light source, and a monitor. These are the 3
because
things.
You have to monitor what is going on in there.
Yes.
In order for you to be able to specifically target where you want to make the intervention.
Yes.
Okay.
So another type of, let me give an example of something that is a little bit different.
Okay.
Sometimes people present to the hospital with something like a liver abscess. It's very common.
Liver abscess.
Abscess.
What do you mean? Is it the same as cirrhosis?
No, cirrhosis is a chronic disease. It's really bad, but liver abscess is just pus in the liver. It's very common. Usually what we used to do in the past, we have to open a big wound on the stomach, and then we go to the liver, we drain, we remove the pus. But with minimally invasive surgery today, just with the ultrasound, with the scan, we locate where is the pus, and then with the needle, we go inside the pus, and then we remove it. That's another type of minimally invasive. For this one, you don't need like image source, light source, like I was saying, and a monitor. You just need an ultrasound machine with a needle, and then you remove the pus.
Wow.
So it depends on which part of the body you are doing your minimally invasive before you talk. It's not the same equipment for all the minimally invasive surgery, but the bottom line is that for all minimally invasive surgery, you need equipment.
And you do not have to cut deep.
Yes.
Yeah, because when you're talking about that, and I think we will say we appreciate technology, because I think that has given us or you doctors, it help you in terms of diagnostics, improving your diagnostic capacity and all of that. So now the patient too is appreciative of some of those processes where it is not going to be the traditional way where you got to cut them and then they will spend more time in the hospital through their recovery processes.
Very important.
Yes, but with this one, like maybe for example, what which you were explaining better on the recent one that was just conducted, I think that patient stayed in let's say 24 hours. The patient was well and already walking around. So yeah. Yeah, so we will come to that. I was just trying to just make to do on that. So okay, so thank you very much for that aspect that has to do with the procedures. And so now we will come to the issue that has to do with the recent surgical operation that was conducted through the help of a visiting medical team and in collaboration with our own local doctors at the JFK Medical Center. So a lobectomy, right?
Lobectomy.
Yeah, lobectomy surgery was conducted some part of last week. Tell us about this and what are those procedures that were used also, and what was the main condition of which that medical intervention was done through the help of a device, also that was a technique that was I think designed by one of the doctors who actually was part of that surgical. Just explain to us that process.
Yeah, so here I need to explain a little bit minimally invasive, then I will come to your question.
Okay.
So actually, minimally invasive, depending on the part of the body where it is done, it will take a particular name.
Okay.
Usually, when it's done in the stomach,
Mm.
that's what we refer to like laparoscopic surgery.
Laparoscopic.
And then when it's done to the chest, like
Mm.
what we did last
Yeah.
week, that's what is referred to like thoracoscopic surgery, you
Okay.
know. And then in short, we call it VATS, like, video assisted thoracic surgery.
Okay.
That's what we did last week.
Mm.
So at JFK, we've been having some equipment to some degree that can allow us to do laparoscopic surgery to
Okay.
some extent,
Mm.
mostly diagnostic laparoscopic surgery, meaning that we can take a camera without opening your stomach with a big wound. We put a camera inside. We can see your stomach, your intestine, your liver, your spleen, everything, even from the down part, like for women, we can see like the uterus, the womb, the ovaries, the tubes. We have that capability at JFK. We've been having it, and these are
Yeah.
things that we
Okay.
can do.
Okay.
But we didn't have some equipment that could allow us to do this minimally invasive surgery in the chest.
Okay.
So our colleagues from Holland and Spain, all the visiting guys that came, they brought new equipment that we didn't have, which can allow us to do some minimally invasive in the chest. So one of those that we did that you mentioned is a patient who had some complications of TB of the lungs.
Okay.
Yeah, pulmonary TB with complication. One of the lobes, lungs are made of lobes. On the right side, we have 3 lobes. On the left side, we have only 2 lobes.
Okay.
So one of the lobes, the upper lobe on the right side, was completely damaged.
Wow.
Usually, when it's damaged like that, patient will be having from time to time some breathing infection, like coughing, some fever, and not breathing good, sometimes chest pain and things like that from time to time. These are complications of TB, even after TB has healed. So our patient had this condition. What it takes with the traditional surgery was to open the chest, a big wound, which we call thoracotomy. And thoracotomy is a very morbid procedure, meaning that it makes people sick. They will be sleeping for a good number of hours. They will not eat. They will be having a lot of pain, and they will stay in the hospital for days, sometimes up to 10 days.
Yeah, during the recovery process.
That's why we don't like doing it much, because it makes the patient sicker than they were even.
Wow.
But with a minimally invasive surgery, it really changes the whole picture.
Wow.
This patient, after we talked to her, she accepted. We took her with equipment that this colleague brought, and we removed 1/3 of the lung on the right side, which we call lobectomy.
Yeah, lobectomy.
The entire lobe of the lung was removed. For that, you need some very specific and special equipment. As I said, we didn't have them.
Yeah.
Thank God, the colleagues brought some
brought
for
them.
us. And together, the visiting team and us on the ground, we were able to
Collaborated.
safely remove the lobe of the lung.
Okay.
And the patient was able to eat the same day in the evening. The patient was able to ambulate, like move around the same day in the evening.
Wow.
And the patient is going to be discharged home today, which is never possible with the traditional,
Surgery.
approach to this. Because, like I said, we could still do this at JFK even without this, but it takes a very major surgery with a long hospital stay, with a very difficult post-op in terms of pain and other complications.
Wow. That's a very great job that was done there by your team and the visiting team. You already mentioned that these procedures can be done, but at the GFK before you have already been doing them. But then this one about the equipment that was used. Those are equipment that you have to have before you can be able to carry on this particular procedure, especially the one that has to do with it. Lobectomy. So yeah. So thank you very much, Dr. Mambaza, for explaining to us. So we would like to talk about the monetary value. You are in the medical field. You know how expensive health, financing is. And with this kind of surgery that was done on this 35-year-old lady at the JFK Medical Center, if she was to be transferred out of Liberia to go maybe to some other hospital, I think in terms of monetary value, the cost for that intervention or procedure, what can you put the cost at?
So I don't know for the Liberian standard, to be honest with you, but let me give you the standard of a place where I've been and I saw this kind of surgery being done, like in the southern part of India. They do lobectomy with the same way we did it.
Sure.
Between 7 to 9,000 US dollars.
Oh, okay.
Yes.
Wow.
Yes, that's for insured patient. So can you imagine for like an African patient, a Liberian patient, you pay your ticket, you pay your stay in India, visa and so on, and then you pay maybe 7,000 US dollars. That's
just for the
really
surgery.
huge.
Yeah,
Yes.
it's huge. It's huge
really
because most often people go at the medical center and don't have, even the money to pay for the surgery or so. And because it is a government hospital charging minimum fees, and even with the minimum fees, they don't also pay that, because of our society that was setting that we have and all of that. So some of these procedures that you do, and helping that lady or to have done that surgery within Liberia, and she don't have to go through all of the constraints of traveling to India or wherever they will be offered and paying that huge amount of money is actually a good thing. And the management of JFK Medical Center, along with your team there from the surgical department, must be commended by the people of Liberia for caring. Thank you for the job that you do. So, folks in Radio Land, if you are just joining this program, this is a reminder that you are listening to the program Inside JFK. Inside JFK comes your way every Monday from 1 o'clock to 1:45 p.m. We bring the medical professionals on this platform, the experts, so that they discuss health-related issues with the public, and then you also give you an opportunity to interact with them, ask them the questions relative to specific medical conditions they are talking about, so that you get those advice and those so that you remain healthy. As the biggest referral hospital in the country and that premier, we look forward to always wanting or seeking your well-being. So we want to say we will open the lines shortly, but we have with us Dr. Mabansa, who is a surgeon, let's say a consultant surgeon at the JFK Medical Center, the Department of Surgery, and he's discussing some procedure at the JFK that I conduct at the JFK Medical Center in terms of minimally invasive surgery. And so we will open the lines, like I said earlier, we announced the number, but we just like to continue the discussion, and then we will come back to your opening lines. So Doc, you wanted to say something in addition before we go to our next question?
Yeah, but so I just want to add to something that you were saying before you open the line.
Okay.
I think it's really important for the people of Liberia to believe in our health system, especially JFK as the major teaching hospital, because what I've encountered, I understand people. Maybe at some point there are services that were not available at JFK, but so many things have changed. So many specialists from so many different places have come in, and things may be a little bit different. So
and it's
what
improved
what I've
as
noticed
compared to
several
before.
times, we see patient at the JFK, maybe with another. This is just a parenthesis I'm opening. Maybe with the breast cancer or some kind of problem in the esophagus. People want to go to Ghana. People want to go to other places.
Even though it can be done.
Even though
But
it can
they
be
want
done.
it,
And the funniest thing is that sometimes, we trained with some of the
people,
colleagues
that
that
in the
are
sub-region,
elsewhere. Sometimes it will be done by a genius surgeon compared to the one who is here on the ground.
Wow.
And then sometimes when you talk to those doctors, they say, well, doctor, well, we saw a patient from Liberia, but we know that you are. I'm like, well, so I think people really need to change a little bit the way they look at JFK.
That's true. The way they look at JFK based on their previous, let's say, past, experiences, right? Like you said, the current management team at the JFK Medical Center had done a lot, in terms of improving the services there and improving our diagnostic capacity and all of that. But just as you stated, in health, people actually take their health they're very careful with it, right?
Which is
so
very
once
important.
they already have a certain mentality, from before, you have to encourage them or convince them that yes, indeed. First, you came. This procedure couldn't have been done because at that time we did not have the expertise, or we did not have the specialists in the country. But now we have them at JFK Medical Center, and we can assure you that if we provide you this service, you're gonna be well, and your situation gonna be addressed and all of that. So that is this is why we have these kind of platforms where you as a doctor who is dealing with the patient on a daily basis, you can come and encourage them
Sure.
to tell them that yes, indeed, GFK is not like it used to be before. There are some improvement being made, and and all of that. So we say thank you again for also using this time to encourage members of the public to believe in the health sector of our country.
Thank you.
So, Doc, there were, in addition to the to the surgical procedure that was done in collaboration with your team by these visiting medical team, they also donated some equipment.
Yes.
Can you tell us about some of those equipment that were donated?
So the equipment that they donated are much related to what we had, to the minimally invasive surgery of the chest.
Okay.
Yeah.
Okay.
So they brought a image source and light source and monitor that is incorporated. Usually,
okay.
what we have for like the abdomen, like the laparoscopic surgery, the equipment that I mentioned that we've been having at JFK is separate. You have a light source separately,
Okay.
image source separately, and a monitor
But
separately.
this one is combined.
This one, everything is combined. It's
Wow.
really recent. Like
Okay.
everything is like in one, and that's
Okay.
really amazing. Yeah,
Wow.
that's the first equipment that we will be using. This same equipment even for the what we've been doing before,
Yeah.
the laparoscopic surgery.
Okay.
Yes, and then even our colleagues from urology side, they will be using this same equipment as well.
Wow. So that equipment will be a very much needed equipment.
Sure.
And going to be used by various departments.
We really appreciate that.
Yeah.
And then they also brought some bronchoscopies. I will break it down. Bronchoscopy is some sort of camera that we put in the nose, and then it goes in the airway. Usually we have kids that we inhale foreign body, be it granite or any kind of foreign body that goes in the airway.
Okay.
It's always difficult for us.
So that So we the last program we had the ENT doctor. I think that way the surgeon.
Yes.
The ENT
so he will be using it. He will enjoy it the most. Yes.
Because he was talking some things about equipment.
But at the same time, this bronchoscopy, even all of us, the surgeons, before we do surgery, the patient has to some extent sleep.
Yeah.
And in order to sleep the patient, the anesthesiologist or anesthetist, they will look at the airway. So with this bronchoscopy, it's much safer. They see where they are putting their tube in order to make the patient sleep. It really, in terms of patient safety, these are things that are going to help.
Wow. So it is the Diagos Gonzalez Ravers Foundation.
Sure.
Okay. And they said, according to an interview I did with them, he said they have a partnership with the Rio Mandre Foundation also. So this is going to be a very like the surgical head said, Dr. Como, he said the partnership that begin with the Dutch Surgical Society,
sure,
which I think sometimes in February they came here and conducted training for laparoscopic procedures and other that at JFK Med. So this identical partnership has blossomed now, bringing in other partners like the Diacos Gonzalez Foundation and all of that. So we really appreciate them for that gesture to the medical center and the people of Liberia. So folks in Redland, as I said earlier on, if you are just tuning in, this is a reminder that you are in tune to the program Inside JFK on ELBC 99.9 FM. And we would like to call the phone numbers so that you call in to participate also to ask Dr. Mabensa some questions about what all of what he just said relative to some interventions, procedures that is done at the JFK Medical Center surgically. And we will like for you to put your questions, your concerns, and other that he will be here to address them. So call us on the following number: 0777 70 35 30, 0777 70 35 30, Or you can also call us on 086 747253, 086 747253. And an alternative Lone Star number is, we will announce another alternative Lone Star number, but you can call us on those numbers in order to be to participate on the program and talk with Dr. Mambensa. Uh, do we have a caller there? Okay, so you can call us on this other alternative number. So it is 0514096, 0880 So call us on those three numbers and we will put you through on the line so that you speak with Dr. Mabasa relative to what he has discussed. And so, Doc, back to you while we are with the callers. So how did this partnership with the Dutch Surgical Society and the Diago Gonzalez Ravas Foundation begin? Do you know how the partnership began?
I know that Dr. Kuman knows more about the
Yeah, he knows
partnership.
more about that. Yeah, so
All I know
well, at
that
least we know that they conducted a training to the Dutch surgical.
sometime last year they were
Yeah.
here and they conducted some sort of workshop in surgical oncology,
Okay,
meaning
surgical
that
oncology.
surgery for cancers.
Okay.
You know, yeah.
Okay.
And then they promised to come again this year for the thoracic something like we said it. They came and they promised again that next year they will be coming.
Yeah, okay. And that's another thing that he mentioned. I think he talked about when I was conducting the interview with him, talk about mobile unit, something like a vehicle, because he said some of the challenges they have faced coming to other parts of the world, or maybe Africa, they have encountered some issue with electricity and all of that. But this mobile medical clinic they are setting up, you're not going to face issue with electricity and all of that, because they're going to set it up in a way that it's already on its way. They will be bringing it so that they'll be able to also reach out in the rural areas to offer care to people in the rural area, not only Maserati County or Monrovia. Yeah, because you know that Maserati or Monrovia is not Liberia.
Sure.
You have to go in the rural areas also to decentralize the health program and all of that. So he mentioned that in the interview, and that's a cool one too.
Sure.
Also, yeah. So just tell us about some of you have been conducting some of those I'd say minimally invasive surgery, right? Not using this equipment or thoracic. Yeah, I think the thoracic aspect of the one I was recently conducted is the first of a kind. Yeah, but you have been carrying on other surgical operations out of that. Can you talk to us about some of them? While we're on our way coming in the car, I saw a photo from you also. Yeah, where another Liberian benefited from that procedure. Let me see if we have a caller here. Good afternoon, caller. Any more you calling from? Welcome to the program Inside JFK.
I'm Beno today. I'm calling from Quebec.
Okay, Beno today from Quebec. Yeah, please go ahead with your point.
I want to know if they can do surgery for spinal cord to JFK too.
Okay, Beno.
I took my mother there and they said she has spine problem.
Okay.
And she needs to go for surgery in India.
Oh, okay. All right. Okay. All right. Thank you. So I think it might be based on after the assessment that was done by, I guess, a Dr. Doe that usually take care of those kind of cases. So depending on maybe the condition and where you're going to get maybe the care that is needed, appropriate care, maybe that's why that recommendation came in. Well, as she said, but I know that there are some other spinal issues, neurosurgical issues that have been dealt with by Dr. Doe. So yes, spinal cord injuries or what have you can be done by at the JFK Medical Center, and the doctor will advise you if you have to seek further medical attention abroad or so. Yeah, Beno. So I guess I have already. You wanted to ask something?
I mean, the scope of spinal problem is very wide.
Yeah,
so it depends on what kind of spinal problem.
What kind? Yeah.
There are some that we cover JFK. Of
Sure.
course, there are also some that we cannot cover JFK.
Exactly. And that's when the recommendation will come in. Sure. To seek further medical attention abroad. So let me just announce the number again before because we are already running out of time. So 0 777 0 777 or 086 747 253 086 747 253, or better still 080 514096 514096. Add the numbers to call so that you can be live on the program inside JFK and speak with our doctor, Dr. Trezor Mambansa, who is a consultant surgeon from the surgical department at the JFK Medical Center, talking about minimally invasive surgery here today. A very important procedure that's been carried out at JFK Medical Center, and with the help of a team that just came in the country, conducted a minimally invasive thoracic surgery on a 35-year-old Liberian, and I can tell you that the recovery process was just within a day. So let's take this caller. And good afternoon, caller. Your name and where you calling from? Welcome to the program Inside JFK.
Good afternoon, Inside JFK.
Good afternoon.
Yeah, my name is Theodore.
Okay, Madam.
I want to know if they can do, because I have two problems. My sister has kidney infection and pressure in the eye. So I really want to know if they can conduct it to GFK, because she went to GFK and then they said she could go Ghana for the kidney, then for the eyes they need to go India. They can do it in India, but they can't do it even in Ghana. The pressure in the eye.
Pressure in the eye.
Yeah.
You mean she met Dr. Niranja from the eye clinic? Because I know that there are a lot of different procedures that have been done at the eye clinic there, even cornea surgery and all of that. So was that the advice that was given her to go where Ghana or India for the eye pressure in the eye?
Actually, met the Indian doctor. Yeah, and then they said our kidney was in the eye. But when she went,
in the eye?
Kidney.
Okay.
Yeah. So that's why they said they refer at the GSK there.
Okay. All right. Okay.
Then when she went, and they said our pressure in the eye. So that's why she came back.
Oh, okay. All right, but I think we've been having some visiting team, especially for the issue that have to do with the eye from India, coming to work along with the hospital there. The eye clinic, the Library Eye Center. So I think she can check back to see as to whether there could be other intervention that could be made. Okay.
Okay. How about the kidney?
Yeah. So she can also come. We have our OPD there to talk to a doctor in the OPD or consultant also for that. I think she left it out. Okay, Doc. So the few concerns from the caller, I think you would want to address some of them before we go to our next. Oh, I think we have this other caller. Let me just take this other caller that off again. Okay. So just go ahead, Doc. Please address concern raised by Benu. Yeah. She said her sister.
I think you appropriately addressed it.
Yeah.
Sure. It's way beyond my scope.
For
eye, there is an eye clinic. So
there's an eye clinic, and I think the eye clinic is more improved now. Yeah, one of the best eye clinics.
But for the kidney, I don't know what she means, because the kidney they shouldn't send to India, to Ghana. We should be able to manage.
Exactly.
If the internal medicine problem of the kidney, we even have a dialysis center.
Sure, we have a dialysis center.
If it's a surgical kidney problem, we have a urology unit.
Sure.
So we should
can
be
address
able to
that.
handle
So
this.
I don't know this is why I was asking her over and over. But anyway, I guess she would take her patient. Good afternoon, caller. Your name and where you calling from? Welcome to the program Inside JFK.
Yeah, good afternoon, sir.
Good afternoon.
Yeah, Simeon Sonka is my name.
Okay. Simeon?
I do join from Puebla to reach beside the nature community.
Okay.
Yeah, I have a problem. My daughter said water into your hair. And so her hair is getting swelled. So we went to here there is. They said she need to go to on a surgery.
Okay.
So if they have data for that, I didn't go work at the GFK there.
How old is it?
How old is she?
She is 4 months now.
Okay.
Oh, baby, 4 months. Okay.
Yeah.
4 months old. Okay, so that will address your concern, yeah?
Yeah, for your
Okay, no problem.
Just keep following. Okay.
For your child, I think if you pick our OPD day, which is I think on Friday, we
Yes.
should be able to see the child, and definitely something can be done for your child.
Sure. So something can be done for your child, Samuel. Just the OPD on the day of you being the OPD.
Friday. No, Dr. Doe will be
Dr.
there,
Doe will
because
be in the
that's
OPD on your.
hydrocephalus. Sorry.
Yeah. So there can be something done. We have our neurosurgeon there who even spoke about that. One time we brought him on this platform, and he spoke about that also, that we have some children who are born water in the head and all of that. So yes, indeed, Simon, you can take your child there at the JFK Medical Center. There will be something done for her. So Doc, let's talk about the other procedure that like you were saying before for the sake of time.
So the minimally invasive surgery that we have been doing at JFK so far is like I said earlier, the liver abscess. We see a good number of them with liver abscesses. Yes, okay. Without opening the skin, we can remove pus from the liver, which is very delicate, but we do it with the help of imaging that we have at the radiology department of JFK, and we have done a good number of them with good result.
Yeah.
The other one is what we call diagnostic laparoscopy. Sometimes people will maybe fight or something. They will stab somebody in the stomach.
Wow.
Instead of opening the stomach directly, if we have some doubt, we put a camera in the stomach, and then we look at the monitor. If the whatsoever they use, be it the knife or whatsoever, enter the stomach and damage the intestine.
Wow.
If it didn't damage the intestine, that's the end of the surgery. So there's no need to make a big opening from up here to down there. Okay. We just put a scope in. This is what we call diagnostic laparoscopy.
Okay. Do we have a caller on the other line? Yeah, good afternoon, caller. Your name, where are you calling from? Welcome to the program Inside
JFK. I'm Mr. Sapla calling from NTA.
Okay, welcome.
Thank you for your program. I'm always follow Inside JFK.
Thank you.
It's so shocking. Since that in studio, I made some kind of advice and clarity. I just received a call about my grandson in Buchanan. That a few days he was playing around, but all of a sudden they just saw something on his eye, the cataract. Okay. And I just received a call making call to the station that the whole thing covered your eye, and he had to see with that eye again. So I don't know what would be your advice. I know it may not.
So you said Tabla?
Yeah.
Yeah. Okay. So Mr. Tabla, you can please bring your child at the Labrador Eye Center. We have doctors there that can be able to do something about that.
JFK, right?
Yeah, JFK Medical Center, Monday to Friday. The Labrador Eye Center is open.
Okay.
Yeah. Okay. Thank you.
Thank you ever so much.
Okay. So Doc, you were talking about some of the surgery. Now we can't take any more calls because of time. So let's just conclude on that.
Oh yeah. So like I said, we do a lot of liver abscesses. We do a lot of diagnostic laparoscopies.
Okay.
And we do a lot of minimally invasive surgery. That's our urology, unit, where they can remove the prostate, they can remove things from the bladder through the camera, which we call cystoscopy.
Wow.
These are things that we have been doing at JFK. Okay. What is going to add to, because of some of the devices and materials that our colleague brought, now we're going to be able to remove the appendix, like appendectomy, without opening.
Wow.
At this point, with what we have now, we can do appendectomy laparoscopically, and hopefully before the end of the year, most likely we'll be able to remove things like the gallbladder without opening at all. Wow. These are major laparoscopic things. I think we're getting there.
Yeah, we're getting there.
What we have, actually, we can expand our practice.
So, and Doc, this is very good news, especially for some of the some of the male that go there with those appendicitis or so, conditions and all of that you treat. So you don't have to do a operation where you open the entire place and all of that. Just insert this equipment, and technology is truly advancing, and the JFK Medical Center is going in line with the help of partners. So we appreciate them again for donating those equipment. along with, in addition to what we already had at JFK and what you guys, your team had already been doing at the JFK before they came to beef up your strength. So, Doug, this is how we like to come to an end of today's edition of the program Inside JFK, and it has actually been a very informative and educative discussion here today. So we would like to take a parting comment from you and your advice to the public.
Yeah, like I said earlier, I think I want our public to believe to some extent, not blindly, but after assessment, to believe in the JFK and the health system in Liberia. There are things that couldn't be done a few years ago. Now they can be done safely at JFK. That's one thing that really people need to know. And then on the minimally invasive side, I think we're on a good track. We don't have everything that we need, but at least we have moved from almost nowhere to somewhere, and we still have a long way to go, but at least there are things that we can do without opening a big wound on the skin. Before I give it back to you, another thing that I always like saying in a way of educating our people, one of the problems that we face is our kids, our children drinking some of the caustic that the people make to use to make soap.
Sure.
I don't like missing this topic. So what I want to add on top of what we said last time is that all those kids that cannot eat, that cannot swallow, depending on tube that we put in their stomach, we have lost follow-up on some of them. The esophageal replacement surgery, like to make them eat again like any other child, that we were not doing like 6 months ago. But now we are good. We have started doing them. So if people know some of those kids, even adults that cannot swallow because they ingested caustic, now we have started doing those surgeries at JFK. And
so you're encouraging those parents to bring back their kids so that you carry out another procedure on them where they will be able to eat. And wow, that's cool. That's great, Doc. Thank you.
You're welcome.
So, folks in Betterland, we want to say thank you for your participation on today's edition of the program Inside JFK. I've been your host, James Bill Creighton is my name, from the Communications Department at the JFK Medical Center. Today, we had the Department of Surgery, and we are discussing minimally invasive surgery. Our discussant for today was Dr. Trezor Mambanza, who is a surgeon, consultant surgeon from the Department of Surgery at the JFK Medical Center. Please do join us next Monday for another fascinating, educative edition of the program Inside JFK. Thank you very much and have yourself a great day. Thank you.